Hello, good evening, Professor and everyone. Today, this workshop title is Exercise During Pregnancy, and it includes some guidelines, benefits, and practical tips. The first one I want to talk is anatomical and physiological changes during the pregnancy. One I want to talk is hormonal changes. In hormonal changes, estrogen level is raised significantly, and promoting the development of the placenta and increasing blood flow to the uterus. Then progesterone relax smooth muscle tissue, which helps prevent premature contractions, but can lead to issues like constipation and heartburn. For the relaxing, softens the cervix and ligaments in the pelvis to prepare for children's birth, but can also increase the risk of joint injuries. The second is cardiovascular change. It can increase blood volume, blood output, heart rate, and shock volume increase, and leading to higher cardiac output. And for the blood pressure, may decrease in the first and second trimesters due to the dilation of blood vessel, but can rise in the third trimester. The third is respiratory changes. In this change, oxygen consumption will increase, higher metabolic demands lead to increased oxygen needs, and it also has some changes in breathing patterns. Breathing becomes deeper and faster to accommodate increased oxygen requirement. The first change is musculoskeletal changes. In these changes, her weight will improve. Average weight gain during the pregnancy is about 25 to 35 pounds, and his posture will also change because his center of his gravity will shift, because his abdomen was heavy than before, and this will lead into change in posture and increase his lumbar lordosis, and his joint will also laxity increase, because the increased relaxing levels lead to more flexible joints and increase the risk of sprains and strains. And the last change is metabolic changes. In these changes, the basal metabolic rate will increase, the body's resting energy expenditure increase to support the fetal development, and the glucose metabolism will also change. In insulin sensitive can increase the risk of gestational diabetes. Second part I want to talk is the benefits of exercise during the pregnancy. Let's talk about the physical benefits. In physical benefits, the most important is cardiovascular fitness. It will regular exercise improves heart healthy, and it will also be good to the weight management, because it can help maintain a healthy weight and reduce the risk of above weight again, and diabetes will also be prevention, reduce the risk by improving insulin sensitivities. For the psychological benefits, the first I want to talk is it can enhance the mood, because exercise release happiness and activities, which can help improve mood and reduce the worries. It's also because physical active can reduce the stress level and improve the mental health. So it can be lead you have a good sleep quality. And for other benefits, the most important is it can be easier for the pregnancy to delivery, because exercise strengthens muscle and improves stamina, which can make labor and delivery easier. And it can also help quickly post-trauma recovery, and it can also reduce the risk of back pain, because while the pregnancy, your abdomen is very heavy, so you like this, your back will get pain. But when you stress the core and maintain good posture, it can reduce the risk of back pain. The last one is can improve the sense of well-being and health. And the second one to talk is relevant contraindication. And first is serious anemia, because the lower red blood cell count can limit oxygen delivery to tissue. And second is unevaluated menstrual cardiac arrhythmia, because it have potential heart complication. And the third is chronic bronchiectasis. Fourth is poorly controlled type 1 diabetes, morbidity, obesity of or underweight, have the history of extremely sedentary lifestyle is also cannot. The first part I want to talk is important exercise guidelines and considerations. The first is general guidelines. The first is the most important is consult with a health care provider. Second is avoid high risk activities, and monitor intensity. Use the talk text. You should be able to carry on a conversation without being too out of breath, and stay hydrated. You must drink much water before exercise, during exercise, and after exercise too. You also need to avoid overheating. And for the specific consideration, you should such like time you after exercise, you should do the cool down, and before exercise you should do warm up. Avoid lying flat on the back. Focus on core stress. The final part is I design a plan as an example of exercise routines. The final is exercise plan. The first is warm up. We do gentle walking or marching in place, and do the arm circles and shoulder rolls. Turn forward, turn backward. The first stress training is squat. We stand with feet shoulder width apart, and sit as if back into a chair, and our knee will behind our toes. Return standing posture. The second is wall push-up. We stand facing a wall with hands placed on the wall at shoulder height, and behind our elbows, and lower our chest toward the wall. And the third exercise is modified plank. We get into a plank position on our knees and forearms, and keep our body in a straight line from height to. The last exercise is pelvic tilts. Lie on our back with knee and bent and feet flush on the floor. Tilt our pelvis to flatten our low back against the floor, and hold for a few seconds, then release. The final is cool and down. Do the gentle stretching. The first is cat stretch, and the second is leg stretch. The third is to stretch our quadriceps and hamstring cables, to stretch our back and our legs. Then breathe deep breath.